Ways to miscarry pregnancy. Early pregnancy medication. To get rid of Rule 486, to get click, spouses of married women in the legal evictions must also give consent to the intervention. A married woman over 18 years of age and act according to their wishes. Regulatory relief. As the name suggests, entirely legal and well known in our country, our contemporary underage woman is a right. Abortion, obstetrics and gynecology only and only applies expert. The transactions remain confidential. Abortifacient. In our country Rule 486 is used. In most countries of the world including developed countries and we evacuated, the vacuum technique described below will be applied. Whether positive or negative pregnancy test is never remove the needle, to resort to methods such as yourself. These drugs work in their pregnancy status is not medically possible. The first pregnancy cannot get pregnant again after an abortion performed. This is the only superstition. Abortion care and a vacuum applied to the woman's genital tract is not expected to harm. In the case of pregnancy medically harmful, the mother is at risk of pregnancy-related diseases, that baby is severely injured or die, as determining whether this time may exceed 10 weeks. In this case, the establishment of creating multiple specialists must decide. Implementation. Legal evictions and local anesthesia, as well as applicable under general anesthesia. If general anesthesia, although it costs a bit, plus, it's completely painless process in terms of watching a modern and effective wine tender carriage technique after weeks of gestation determined by ultrasound examination is performed. Gynecological care. Vaginal and cervical bacteria free in order to be disinfected, after the cervix to secure a plastic instrument through the vagina, and place local anesthetic according cervix is injected into the, or general anesthesia by the anesthesiologist. Appropriate action is initiated. Then a very thin plastic cannula is pushed through the cervix into the uterus. Sometimes the cervix can be harsh or 6 weeks of pregnancy, due to the use of larger diameter plastic cannula may be required. In this case the cervix to expand special spark called the instruments used. After placing the cannula is attached to a syringe. The inside of the uterus with the help of the vacuum created in the syringe is poured in vacuo, which is close to the 10th week of pregnancy. Sometimes completely empty the uterus by inserting metal objects into the uterus may need to be sure, but this is rarely the case. The inside of the uterus after the cannula is removed completely empty, all other instruments are removed and the patient is provided rest for 10 minutes. All these operations up to 6